I'm Brian MacGrory. I'm a neurologist at the Duke University Medical Centre. My particular specialty is vascular neurology, and that's patients who've got problems with the blood vessels in the head and neck. I also deal with a wide variety of other issues that people may have, such as seizures, migraine, disorders of movement, disorders of muscle, and autoimmune conditions as well. One of the privileges we have at Duke Health is that very often we're seeing people as a second opinion, and when people come in that context, oftentimes they bring a very lengthy and complex story to the table, and it's a real privilege to be able to hear and understand that story. Oftentimes the first visit is devoted almost entirely to understanding and listening to a patient and understanding their story and their expectations. And I think the other thing that I find rewarding about working at Duke is that it's a very academic environment. People in the neurology department, very often they're leaders in the field and leaders of what they do, and part of the prerequisites of doing research in a particular problem involves understanding the existing research and the existing treatments in great detail and great depth. And that's why you can be assured that if you see a person at Duke, you're getting that very high quality of care. I do research in two main areas. The first is I'm interested in stroke, but particularly stroke affecting the eye. We think of stroke as something that affects the brain, but actually a small proportion of strokes affect the eye. And historically this has been more challenging to recognise and treat, and something that we're pioneering at Duke is advanced therapies for stroke affecting the eye. The name for that is central retinal artery occlusion. The second thing that I'm interested in is what's called cryptogenic stroke, which simply is stroke for which we don't understand the reason. And one of the most satisfying things that you can do as a stroke neurologist is take a person who's suffered one of these so-called cryptogenic strokes and guide them through the process of understanding and recovering from it, and ideally preventing another one, and perhaps more particularly finding a cause for it, which is one of the most rewarding parts.